This is the what I think is the last civil right is to good care when you live and you are helping someone live with dementia. It's a personal right to care, and we are not supporting that. I mean, we really have so many ways in which we dismiss people as human beings and their care supporters as
Yes.
human beings that are being harmed, actively harmed by this system.
And for me, my mother died in August last year, and the last 6 years she was at a caring home. And after she got really mad at me for putting her there, as
I'm
she
sure she did.
was my fault and everything. And so I felt like, did I do the right thing? Have I been the best daughter? Could I have done things differently? I had lots of bad conscience about like all the things I've done and not done. And but after
So Marianne, before you go further, here's a question that we have in the States a lot. Are the care staff in nursing homes required to do any skill building training around dementia? Are there courses that they have to take to show they have skill at helping people live with dementia?
they don't have to take them.
Uh-huh.
They are offered.
Uh-huh.
We do have like different health workers with different degrees of competence. But I experienced that the thing that you are very invested in, the personal care, the personal individualized care.
Yep.
It's not something you have to have, but
Yep. That's
something
right.
everyone should have.
I mean, if I'm going to do this with someone else, not for or to someone else, in my mind, you need special skills for this. This is not just you walk in and say, okay, well, let's get your sweater off, Marianne, and get you in the shower. It's like, whoa, 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 whoa.
And just like an example of that, because now there's like headings in the newspapers where they say that the staff or the health care people working at the care homes are so tired and so exhausted from aggressive behavior. And I'm like, but that's the case is that the person's living
You're
are
starting
scared and they're frustrated that they don't get the care, and headlines are about the people working there, and that's like the opposite of,
Like, when are we going to quit blaming the person who's living with dementia inside them for having dementia? I mean, it's like, and develop strategies that don't force them to communicate that way, because they're communicating that way because we force them to communicate that way. I don't listen to anything else. So, we're going to take three of you, take your clothes off. I don't know how anybody thinks that is a way to offer quote unquote care. It just doesn't jibe with being a person. Unless I'm saying, wow, my balance is really bad. I'm going to need several people to help me because I just can't figure out where my legs are. I mean, that is a very different scenario. That is not what we're talking about here at all.
Yeah. So not knowing anything about how to communicate with my mother as she got like more and more into the disease, I kind of, how do you say it? I just tried out different strategies to communicate with her. And I figured out that if I could make her use all her senses, like smell, the tactile, her, of course, taste, and music. I tried all these different things to trigger her memories, to make my mother come out of this disease. So I learned how to get, even though she was really sick, I learned how to get like a good moments with my mom. And no one taught me that. I think that's something we really should teach both caregivers and, of course, in the care system. That there's, but if you're gonna help them uh, get their get like how do I
Meet
say?
their needs, meet their
Yes,
needs, get
need
their needs met. Yeah.
time and knowledge and
Yeah.
know the person. Like my mom, she loved tulips. Whenever
Ooh.
she was happy. When she heard Cliff Richard singing, she was happy. When she could eat this special biscuit, she got memories from a bicycle trip with her.
Perfect.
It was like, okay, give her more of this.
Yeah. Yeah. That's what makes life still worth living. And we can get through some hard times together if we have those moments. It's when no one seeks to find those moments because they don't even think they exist. And it's like, well, they're there. You have to help. I mean, there's no way the person can go elicit them on their own. However, by then, I mean, if we start earlier, starting with conversations and abilities, I mean, where we learn, it's like, I know you don't want to talk about this, mom, but I have two questions for you, and then I'll quit. Now, that kind of framing limits how much we're going to do. And it's like, well, I don't want to talk. I know, but two questions, 5 minutes, and we're done. And I'm not going to talk about it again. I want us to talk for 5 minutes.
Yeah.
That's a very different way than I don't want to talk about it. And we go, okay, we're no talking about it because mom said no. And it's like learning how to do these things. Families, I don't know about in Norway. In the US, families are providing about 80% of all care. 80%.
Yeah. I don't have those numbers in Norway, but the government here wants us all to live at home as long as
Uh-huh.
as
Yep.
long as
Yeah.
and they're trying to put the system together so that they will support this aim, but it's not really working.
Mm,
Uh,
yeah.
but then
Yeah.
again, we have high expectations to our health care system because it's been good over so many years.
Yeah.
And the people who are getting old now are the people who built the system, and they're not.
Wait a
They're
minute. This is supposed to work differently than it's working here. Yeah. So you have been doing a lot of work trying to advocate for better quality support systems for people living with dementia and those who are supporting them.
yeah.
And you've done a TED Talk.
Yes, I've done a TED Talk, and that was also a very exciting thing to do about this
Yeah.
project. And I even I even started my TED Talk with a song, singing. Yeah,
Yes.
because music was the most important thing in
See?
communication with me and my mom, especially at the end, uh,
Mhm.
where there was no language.
Yeah.
So then you probably know the song Que Sera Sera.
Oh, yeah.
We
Oh,
have
Doris Day, old movie.
Yeah. And so I sang this song when my mother died, and we've sang it so many times together during my upbringing, and
Mhm.
and for me, telling the story about my this experience with Alzheimer and my mom, and how to use the experience that was really, really tough to something that could help others had
Mhm.
a drive for me. So I started a podcast about like 2 years ago I have 140 episodes about this with the scientists, with other caregivers, with people in the healthcare system, trying to like show the different perspectives on this awful disease, but also the good stories.
Mhm.
And I've written a book about the same thing, and I travel around my country, talking to other caregivers and health personnel about this because it's stigmatized still in Norway. And it's,
Well, yeah. And everybody thinks another country is so far ahead of I mean, everybody has this vision that there's this magic country where this is done well. And it's like,
so
I mean,
true.
we're all working on it. Nobody's gotten it under control yet, and there are those of us out there doing the best we know how. So we link up, we connect. And when we link up and connect, then we can spread even deeper and wider. And so what I want to make sure when folks leave this little piece here is that they go check out your TED Talk, they check out your podcasts, because there are pieces and bits and big chunks of things that can make a difference in people's lives. And that's what people need to recognize, is this is a worldwide phenomenon. And even countries that have devoted a lot of resources to support in healthcare still are not seeing dementia for what it is, which is probably this century's biggest issue that's coming down the road. And I don't know about you, my concern is we're not going to have research to cure this thing anytime real soon. So we better figure out how to do care for one another and care with one another.
It's like my country, the leaders of my country, it's like they're doing like this.
Uh-huh. Well, put your hands in front of your eyes too.
Yeah, it's like
Yeah, there you go. It's like,
maybe
no, it's good. It's all good. It's like,
yeah, it's like they think
here's a penny.
"Hey,
What can your penny do? Yeah, it's like, no. Well, I think together we are stronger than separate. And so thank you so very much for coming and speaking with us and helping to spread the word globally that we have got to address this, and we've got to get politicians out of their safe spaces and into the real world of dementia, because we've got to get support structures in place. And it's not, especially in your country, it's not like that we're talking, we need it to cost more, we need it to be better. We just need it to be better. In our country, we just like, families are just supposed to suck up this cost. And it's like, this is expensive to do this well. Woo. And so we have lots of issues that at least you don't have, but you still have all these issues. And I think that's the part that's like, oh, well, that's not good. So thank you.
Thank
for what
you
you're doing.
for having me.
Yeah. And thanks to everyone out there for listening and being curious. And if you want to learn more, check out the connections and see what you can do for advocacy. Again, we're stronger together than we are separately. Take care, everybody.
Hi, I'm Teepa Snow, and you just found our YouTube channel and watched one of our videos. I'm the owner and founder of Positive Approach to Care. Thanks for watching. And if you liked, if you have a comment about, or you would, please share it with people you know. Oh, and if you haven't yet done it, consider subscribing. We'll let you know when the next new video comes out. And you might want to visit our website, www.teepasnow.com, where you'll find other resources as well. See you there.